Plantar fasciitis is one of the most common causes of heel pain, primarily affecting the bottom of the foot. It occurs when the plantar fascia, a thick band of tissue that runs along the bottom of the foot from the heel to the toes, becomes inflamed. This tissue plays a crucial role in supporting the arch of the foot and helping with walking, running, and other activities that involve bearing weight. When the plantar fascia is overused or stressed, it can lead to small tears or inflammation, causing pain and discomfort. The most common symptom of plantar fasciitis is sharp, stabbing pain, especially with the first steps in the morning or after periods of rest. The pain may subside somewhat after walking for a few minutes but may return after prolonged standing or after activities such as running or jumping. The pain is usually localized to the bottom of the heel but can also radiate along the arch of the foot. Several factors contribute to the development of plantar fasciitis, including 1. Overuse and repetitive stress. High-impact activities like running, particularly when done on hard surfaces, can strain the plantar fascia. People who engage in sports or activities that require frequent jumping or running may be at higher risk. 2. Foot structure. Certain foot conditions, such as flat feet, fallen arches, or high arches, can place additional stress on the plantar fascia. People with abnormal foot mechanics or gait how they walk are more likely to develop plantar fasciitis. 3. Age. Plantar fasciitis is most common between the ages of 40 and 60, although it can occur at any age. This is often related to the natural aging process of the foot, including a decrease in the elasticity and strength of the plantar fascia. 4. Obesity. Carrying excess weight puts additional strain on the plantar fascia. The more weight the foot has to bear, the greater the stress on this tissue. 5. Improper footwear. Wearing shoes with inadequate arch support, poor cushioning, or a lack of heel support can contribute to the development of plantar fasciitis. High heels, flip-flops, and shoes with flat soles can exacerbate the condition. 6. Occupation. Jobs that involve standing or walking for long periods, such as teaching, factory work, or retail, can increase the risk of developing plantar fasciitis. Diagnosis and treatment. Plantar fasciitis is typically diagnosed through a physical exam. A doctor may press on specific areas of the heel to assess the location and intensity of the pain. In some cases, imaging tests like X-rays or an MRI may be recommended to rule out other potential causes of heel pain, such as stress fractures or heel spurs. Treatment for plantar fasciitis usually involves a combination of conservative measures aimed at reducing pain and inflammation, and improving foot mechanics. 1. Rest and ice. Taking breaks from activities that exacerbate the pain, along with applying ice to the affected area, can help reduce inflammation. 2. Stretching and strengthening exercises. Stretching the calf muscles and the plantar fascia itself can relieve tension and reduce pain. Strengthening exercises for the foot and lower leg can also improve stability and prevent future injury. 3. Orthotic devices. Custom-made or over-the-counter arch supports and insoles can help redistribute pressure across the foot and provide better arch support. In some cases, night splints may be prescribed to keep the foot in a dorsiflex position overnight, which helps stretch the plantar fascia. 4. Anti-inflammatory medications. Non-steroidal anti-inflammatory drugs and NSAIDs, such as ibuprofen, can be used to reduce pain and swelling. 5. Physical therapy. A physical therapist can guide patients through exercises aimed at improving flexibility, strengthening the foot muscles, and reducing strain on the plantar fascia. 6. Corticosteroid injections. In cases where conservative treatments fail, a doctor may recommend corticosteroid injections to reduce inflammation and provide relief from pain. 7. Shockwave therapy. Extracorporeal shockwave therapy (SWT) is a non-invasive treatment that uses sound waves to stimulate healing and reduce pain in the affected area. 8. Surgery. In rare cases where other treatments are unsuccessful, surgical intervention may be considered. Surgery may involve releasing the tension in the plantar fascia or removing any bone spurs that may have developed. However, surgery is generally seen as a last resort. Prevention. To prevent plantar fasciitis, it's important to take steps to avoid excessive strain on the feet. Some tips for prevention include wearing supportive footwear with good arch support and cushioning, maintaining a healthy weight to reduce strain on the feet, stretching regularly to keep the calf muscles and plantar fascia flexible. Avoiding excessive high-impact activities without proper preparation or footwear, gradually increasing activity levels to allow the feet to adapt to new stresses. Plantar fasciitis, while often painful, can typically be managed effectively with the right treatment and preventive strategies. With proper care, most people recover fully and can return to their normal activities without significant long-term issues. Thank you for watching my video. Please subscribe my channel.